At Lake Stevens Chiropractic, the most common conditions we treat are pain associated with the spine, lower back pain, sciatica, neck pain. We take care of a lot of patients involved in car accidents, whiplash type injuries, some work injuries. Headaches is another very common symptom. So the most common are going to be headaches, neck pain, lower back pain, mid back pain, sciatica, disc type issues. We do take care of a lot of pregnant women, work with them through their pregnancy. Chiropractic is very effective at helping through those processes. And also we take care of children all the way up from the time of infancy and through just childhood trauma, whether it's associated with birth or through the growing up years. The short answer is no, the vast majority of times. Specifically, chiropractic adjustments actually relieve the pressure. When the joint is fixated or locked, there's an inflammatory response that happens that causes the joint to swell. That's where a lot of the pain comes from. When we adjust, we actually relieve that pressure. And as that joint starts to move better, the fluids flow through the joint and it cools or soothes that joint down. So typically it feels wonderful to get adjusted. There are a few cases where when the patient's really acute, we have to work through and gradually work that joint to get it to move to start with. And it can have some short-term discomfort, but very short-term as we work through that. So the purpose of the adjustment is to improve that mobility and help it to move better and feel better. It really depends on the person. I have some patients that will come in and within 1 or 2 adjustments, they're feeling substantially better. And what we say by that is at least 50%. Obviously, if a patient has had an issue for a long time, it's more chronic, that can take longer to respond. If it's more complicated, like we have car accidents or trauma, different forces where ligaments and structures have been injured around the joint, that can also take much longer. But as a general rule of thumb, typically within about 12 visits, you should feel a substantial improvement as far as your pain and your general function. Chiropractic adjustments are very, very safe. There's been a lot of research done on this. Chiropractic, again, is a natural form of healthcare. We're not putting anything into the body. We're not taking anything out of the body. I think probably the most substantial research is research that's been done by malpractice insurance companies where they look at the risk factors for all the different professions. And chiropractic consistently ranks at the lowest level of risk. The malpractice premiums are based upon that risk, and chiropractic premiums are the lowest out of just about any profession there is. We always do a specific exam and we rule out different factors that would qualify whether a patient is a chiropractic patient or not. But with a qualified exam, chiropractic is very, very safe. Your first appointment at Lake Stevens Chiropractic, we will have you come in. The first part is we'll do a consultation. We're gonna listen and hear what issues you're dealing with, what your primary concerns are. After that, we're gonna do an examination. That is a full examination, including orthopedic testing, neurological testing, posture analysis, range of motion testing. From that exam, we're gonna make a determination on whether there's any further imaging needed. In most cases, x-rays are commonly needed, and so we'll take x-rays on site. We have a digital x-ray set up on site. And once we get the x-rays and we've done the exam, we typically will review all of that material before your treatment. And so we typically will have you come back the following day as an example, and we will go through a report that we've put together that explains the issues that you're having, why you're having them. We go through your x-ray findings, and then we go through our treatment recommendations, and at that point we would start treatment. We're commonly asked, who will I see at Lake Stevens Chiropractic? There's 3 doctors in the office. There's myself, Dr. Mike, and Dr. Song. We all 3 work together as a team in the office. Most of us are here each day during the week. There are a couple days when one doctor's not here and the other doctors are here, but we all work together as a team to take care of you. At Lake Stevens Chiropractic, we do take insurance. We're a preferred provider on most of the major insurance carriers. This includes Premier Blue Cross, Regents Blue Shield, Aetna. We're on as preferred provider with most other carriers. So if you ever have a question on whether your insurance company is covered in our office, you can just call the office and ask us and we'll verify that. When you come in, one of the things we do is we always get a copy of your insurance card, and then we call and verify your benefits. And before we do any services, we will have an understanding on what your insurance covers or what it doesn't cover. And we'll always quote that to you in writing ahead of time so there's no surprises. These are the most commonly asked questions that we get at Lake Stevens Chiropractic. Book a free consultation at lakestevenschiro.com. Look forward to seeing you. I've been practicing for the last 34 years. Love what we do here at the office. Come into our office. We'll take great care of you.